Hi, this is Dr. Sushma Sukruthi, a consultant dermatologist and assistant professor at Kamineni Hospital, Selvinagar. So, ivala manam maatladukoboye topic hair fall. What is hair fall? So, more than 100 hairs falling per day is hair fall. So, 100 hair or danikante takkuva every day if it is shedding, then adi hair fall kaadu. So, normal ga head bath chesinappudu leda hair comb chesinappudu we will see a good amount of hair fall, which is normal for everybody. But if it is excess ga undi ante, then it is troublesome. So the first, that is hair fall. ఇప్పుడు నెక్స్ట్ ఏంటి, వాట్ ఆర్ ద రీజన్స్? ఇప్పుడు రీజన్స్ ఏంటి అంటే మెయిన్లీ స్ట్రెస్ టు ద బాడీ, విచ్ కుడ్ బి ఫిజికల్, విచ్ కుడ్ బి మెంటల్ ఆర్ ఇన్ ఎనీ అదర్ వే. సో ఫిజికలీ సమ్ ల్యాక్ ఆఫ్ స్లీప్ ఆర్ ఫిజికల్లీ స్ట్రెనస్ యాక్టివిటీస్, excessive activities or no proper nutritious diet will cause stress to the body. Okay, and the other reasons will be for stress are either fevers like typhoid, dengue, malaria, COVID. All of this will cause hair fall because the body will go through a period of stress during this time. So then the next kind will be because of nutritional deficiencies. Now nutritional deficiencies mainly hemoglobin takku undadam, raktam takku undadam, iron takku undadam, then vitamin B12 deficiencies gaani, vitamin D3 deficiencies, deficiency of proteins also will cause hair fall. Then endocrinological problems, ఏదైనా ఇన్సులిన్ రెసిస్టెన్స్ ఉంటే హెయిర్ ఫాల్ రావడం, మెయిన్గా ఇట్ విల్ గో ఇన్ టు బట్టతల బాల్నెస్లోకి. అండ్ దెన్ వన్ మోర్ ఇస్ థైరాయిడ్ డిజార్డర్స్. సో థైరాయిడ్ డిజార్డర్స్లో కూడా వీ విల్ సీ ఐదర్ హైపర్ కానీ హైపో కానీ, వాట్ ఎవర్ కైండ్ ఆఫ్ థైరాయిడ్ ప్రాబ్లమ్ వీ యూజువలీ సీ హెయిర్ ఫాల్స్. సో క్యూములేటివ్లీ దీస్ ఆర్ అ ఫ్యూ రీజన్స్ that we can normally and identify as reasons for hair fall. Okay, so how do you actually treat hair fall? So mainly the treatment will be to rule out any form of stress. Now that like we've already described, are the fevers, previous fevers, and what is the reason behind that? Then major surgeries, then a major accident. So we will rule out the cause, and then if this history negative undi, and then we will see for some nutritional deficiencies also we will rule out. We'll do some tests and rule out the nutritional deficiencies. So accordingly we can treat you for hair fall. But apart from that, normal biotin supplements to gani, we will give you some serums containing Procapil, Capixil, caffeine, these serums or Rodensil, minoxidil serums for a good hair growth. And then along with that we can do some PRP injections, platelet rich plasma untundi, where we draw your blood and then separate the growth factors from it and inject back into your scalp. So this procedure can be done to help you with hair fall. Then advise you to for a good 6 to 8 hours of sleep and have some nutritional diet. So this is something that you can be doing. And how can you prevent hair fall? Is definitely taking care of your nutrition, your diet, and preventing insulin resistance, that is cutting down on all forms of food that cause a high insulin spike or a sugar spike, that is high glycemic index foods ni avoid cheste, you will to some extent cut down on the baldness and balding effects kaani kuda takkuvaipothayi. One of the most important reason for hair fall in a reproductive age group for women will be postpartum hair fall mainly. So postpartum hair fall also 3 to 6 months after childbirth and it start avutundi. The reason behind this is mainly hormonal change and inkokati lack of sleep because of the new child, and in some communities proper nutritious diet they do not provide, and then a lot of stress and anxiety and postpartum blues, all of this add to your hair fall. So that usually starts 3 to 6 months later, and then we see hair fall then becoming normal after a period of 3 to 6 months. So that is, it starts off and then it gets better. If it is not getting better, then you can walk to your nearest dermatologist and get it treated.